Welcome to our transfer training DVD. At the conclusion of this training video, you should feel confident in your ability to work safely in your environment without injuring yourself or the students you serve. Statistics from the Bureau of Labor from 2012 report that 36% of sprain, strain, and tear cases reported that required missed workdays were because of back injuries. Also, musculoskeletal disorders involving the back require a median of 7 days out of work to recuperate and accounted for 41% of all the musculoskeletal disease cases recorded. Back disorders can develop gradually or as a result of microtrauma brought about by repetitive activity over time or can be the product of a single traumatic event. Because of the slow and progressive onset of this internal injury, the condition is often ignored until the symptoms become acute, often resulting in disabling injury. Acute back injuries can be the immediate result of improper lifting techniques and/or lifting loads that are too heavy for the back to support. While the acute injury may seem to be caused by a single well-defined incident, the real cause is often a combined interaction of the observed stressor coupled with years of weakening of the musculoskeletal support mechanism by repetitive microtrauma. Essentially, a small event can be the straw that breaks the camel's back. Back injuries can occur in muscles, ligaments which help hold the spine together, tendons which connect the back muscles to the spine or other bones, at the vertebra, the individual bones that make up the spine, or at the discs in between each vertebra. There are several specific factors that are commonly associated with back disorders. These include reaching while lifting, poor posture, stressful living and working activities, such as repetitive motions or staying in one place for too long, bad body mechanics, this is how one lifts, pushes, pulls, and carries objects, poor physical condition, losing strength and endurance to perform physical tasks without strain, poor design of the job or workstation, which we call ergonomics, repetitive lifting of awkward items, equipment, or patients, or in our case students, twisting or bending while lifting, also maintaining bent postures, heavy lifting, fatigue, poor footing, lifting with forceful or jerky movements, and vibrations can all cause injury. Everyone who has ever lifted a patient or any heavy weight improperly knows that the back suffers the most. A back injury is probably the most significant occupational hazard, and once you develop a back injury, it tends to reoccur. Fortunately, there's much you can do to avoid injuring your back. You may need to rethink the way you lift and bend, but it is worth the extra effort. Using proper body mechanics is imperative to avoiding injury to yourself or others while working. Body mechanics is defined as use of one's body to produce motion that is safe, energy conserving, and anatomically and physiologically efficient. Using proper body mechanics increases safety for you and the students you may be transferring. The four basic principles of body mechanics are as follows. Number 1, keep your back straight. Your legs, not your back, should do the work. 2, bend your knees, squat, and use your thigh muscles. Squat directly in front of the object you plan to lift, keeping it close to your body. Then slowly rise to a standing position. Never lift with your legs straight. 3, get close to the student as possible and bend your elbows. A weight, in this case the student, is heavier at the end of a long lever arm. 4, maintain a wide base of support by placing one foot in front of the other. These hints incorporate good body mechanics and are useful to guard your back at all times, not just when moving or lifting a student. In this illustration, note the position of the caregiver's feet. She has a wide base of support. Also notice how close she is to her patient. She is bending her knees and keeping her back in a neutral position. When we talk about keeping the back straight, we don't actually want your spine completely straight because we want it to maintain its natural curves as seen here. We call this the neutral spine position. Let's talk about the specifics of lifting. Always plan ahead before lifting. Knowing what you're doing and where you're going will prevent you from making awkward movements while holding something heavy. Clear a path, and if lifting something with another person, make sure both of you agree on the plan. Lift close to your body. You will be a stronger, more stable lifter if the object is held close to your body rather than at the end of your reach. Make sure you have a firm hold on the object you are lifting and keep it balanced close to your body. Feet should be shoulder width apart. A solid base of support is important while lifting. Holding your feet too close together will be unstable. Too far apart will hinder movement. Keep the feet about shoulder width apart and take short steps. Bend your knees and keep your back straight. Practice the lifting motion before you lift the object and think about your motion before you lift. Focus on keeping your spine straight. Raise and lower to the ground by bending your knees. Keeping your eyes focused upwards helps to keep your back straight. Tighten your stomach muscles. Inhale, preferably through your nose. Set your abdominals, and as you lift, exhale, preferably through your mouth. Tightening your abdominal muscles will hold your back in a good lifting position and will help prevent excessive force on the spine. Lift with your legs. Your legs are many times stronger than your back muscles. Let your strength work in your favor. Your head should lead the lift, which means your hips should not come up before your head. Again, lower to the ground by bending your knees, not your back. Don't twist or bend. This places stress on knees, hips, and back. Pick up your feet to pivot. Face in the direction you are walking. If you need to turn, stop, turn in small steps, and then continue walking. If you're straining, get help. If an object is too heavy or awkward in shape, make sure you have someone around who can help you. Break the habit of bending. Break the habit of bending from the waist to pick up anything, even a piece of string on the floor. Bend your knees or use a golfer's lift. A few key points to remember. Always maintain your feet shoulder width apart. This gives you a wide base of support. Keep your spine in the neutral spine position, bending your knees, not your back, and get as close to your patient as possible. It is highly recommended to use a two-man lift for students weighing 40 pounds or more. This can be done with one person at the upper body and one person at the lower body of the patient, or with one person on each side of the patient with an arm under the patient's arm and under a leg. Stand up at the walker, okay? Okay. All right, on the count of 3. 1, 2, 3. In which picture, the left or the right, is the man utilizing proper lifting techniques? The right picture is correct. The man is close to his object and is bending at the hips and knees instead of bending his back. Now, which picture is correct? The left picture demonstrates the correct lifting technique. The man is close to his object to make the task easier and to avoid bending his back. Which picture shows the best technique for reaching a high object? The right picture demonstrates the best technique. It is always a good idea to get a step stool instead of reaching overhead and or standing on your tiptoes. The extra effort it takes to go find a stool will save you from the possibility of dropping items on your head and will make the task easier because it will be closer to your body. Now let's discuss pushing and pulling. Let your arm muscles, not your back, do as much of the work as possible. Place the object on wheels or a cart whenever possible. Always work smarter instead of harder. Push parallel to the object. This makes the object slide easier and requires less effort. Slide or roll objects if possible instead of lifting and carrying. This is obviously not an option for transferring our students. As a general rule, push objects instead of pulling if you can. Now a few notes on sitting posture. Your chair should be at a height so that when you sit, your feet should be flat on the floor with your hips and knees at 90-degree angles. You should also maintain a neutral spine position when you sit. This may require the use of a lumbar support placed in the chair at the area of your low back for comfort. If you are at your computer desk, you should always try to position your monitor where you are looking straight ahead and at eye level to reduce strain on your neck. Which picture demonstrates the correct sitting posture? Of course, the picture on the right demonstrates much better sitting posture than the one on the left. His feet are flat on the floor, his hips and knees are at 90-degree angles, and his back is aligned well instead of sitting slumped. As we near the end of this training video, let's go over a few key points to remember. Always plan ahead. This is especially important if the lift involves 2 people so that you are both on the same page. All right, we're going to go to this chair on the count of 3. As a general rule, the person at the head should be the one to do the counting. Never bend your back to pick something up. It's just not worth the damage that improper lifting techniques can cause. Hold objects close to your body. You are much more stable if you are not reaching for an object. Keep your eyes up. Looking slightly upwards will help you maintain a better position of your spine. For more specific instructions on how to transfer students in and out of a gait trainer, how to transfer students to a support station, or how to use the Riften solo lift, I encourage you to visit the Riften website. Go to www.riften.com. From there, you may want to click on Resources and then choose Transfers and Lifting for a variety of videos and how-to articles. A specific article you may want to review is titled Transfer into the Pacer Gait Trainer. The video titled Sean Walks Again Video Part 1 includes video of Sean being transferred into his gait trainer. The easiest way to find either of these resources is to type the title into the search bar at the top of the page. For a demonstration with the Riften support station, the video Adaptive Toilet Transfers at a Move Facility Riften Support Station Video 2 is quick and informative. These are just a few suggestions to get you started on the Riften website. It is a really great resource for you to familiarize yourself with. Also, if you have any questions, ask the physical therapist at your school. They would love to demonstrate techniques, answer questions, and problem solve along with you. Please take care of your back by using correct body mechanics. Our desire is for your safety and the safety of our students.